Hello guys, my name is Dr. Norris Azuma. Did you know that hepatitis B silently affects almost 300 million people worldwide? This powerful liver virus can go unnoticed for years, slowly causing serious damage and even increasing the risk of liver cancer. The good news is there are ways to protect yourself, manage infection, and prevent its spread. Now, what is hepatitis B? Hepatitis B is a viral infection that specifically targets the liver. The virus can cause severe damage to liver cells, leading to conditions such as liver scarring and liver cancer if it's not controlled. Hepatitis B virus is highly contagious, especially through blood and bodily fluids, and it's so easy to catch than other viruses like HIV. How does it spread? Hepatitis B virus can spread through multiple routes involving blood or bodily fluids. The main ways include unprotected sex. Engaging in sex without protection can lead to hepatitis B infection if one partner is infected. Sharing of sharps or needles. Injecting drugs or using shared needles, even for tattoos or piercings, poses a high risk. Mother-to-child transmission. Pregnant women with hepatitis B can pass the virus to their babies during childbirth. This is the most common route in Africa. Direct contact with infected blood, even small cuts or wounds exposed to infected blood, can spread the virus. Importantly, hepatitis B does not spread through contaminated food, water, coughing, or sneezing. Who is most at risk? Certain groups have a higher risk of hepatitis B. These include newborns of infected mothers, people who inject drugs or share needles, healthcare workers exposed to blood or bodily fluids, individuals living with someone who has chronic hepatitis B virus, people who frequently travel to areas with high hepatitis B viral rates. Hepatitis B virus can be acute or chronic. Now, acute hepatitis B. This is a short-term infection that lasts less than 6 months. In many cases, the immune system can clear the virus on its own, often without any long-term effects. Chronic hepatitis B. If the body cannot clear the infection within 6 months, hepatitis B virus becomes chronic. Chronic hepatitis B viral infections can last a lifetime and often lead to serious liver damage over time. Infants and young children are more likely to develop chronic hepatitis B virus if infected. How do you know you got it? Usually, you don't know you got it for months or even years. That is why it has the nickname the silent infection. When symptoms do appear, they may include yellowing of the skin or eyes, otherwise known as jaundice, extreme tiredness or weakness, dark-colored urine, light-colored stools, nausea, vomiting, or loss of appetite, abdominal pain, especially near the liver, and even fever. Symptoms can appear 1 to 4 months after exposure, but some people never experience noticeable signs, especially in chronic cases. Long-term risk of chronic hepatitis B virus increases the risk of severe liver complications. But don't guess, it can be diagnosed. Blood tests are used to determine 1. If someone has an active infection, whether they have cleared the infection or have immunity, the extent of liver damage in chronic cases. Tests like liver ultrasounds or biopsies can assess liver health and detect any complications like cirrhosis or cancer. What are the treatment options? For acute hepatitis B, most people recover with rest, hydration, and supportive care. Acute cases rarely require antiviral treatment. Chronic hepatitis B. Treatment focuses on controlling the virus and preventing liver damage. Antiviral medications can suppress hepatitis B virus, helping prevent liver complications, but may require lifelong adherence. In severe cases of liver damage, a liver transplant might be necessary. Importance of vaccination. The hepatitis B vaccine is the most effective way to prevent infection, offering over 90% protection when completed. It's typically given in a series of 3 or 4 doses, especially for newborns and children, healthcare workers, people who are at high risk due to lifestyle or environment. Since introducing the vaccine, rates of new hepatitis B viral infections have dramatically decreased worldwide. But hey, you can lower your own risk. Use condoms during sexual activity. Avoid sharing needles or personal items like razors or toothbrushes. Pregnant women should be screened for hepatitis B viruses to prevent passing it to their babies. Healthcare workers and those who handle blood should always follow safety protocols to avoid accidental exposure. Do you have hepatitis B virus? It is not the end of the world. People with chronic hepatitis B virus can often live normal lives with the right lifestyle and medical monitoring. Avoid alcohol and certain medications. Alcohol and certain over-the-counter medications like paracetamol can strain the liver, so it is best to limit or avoid them. Healthy diet and regular exercise. Keeping the body healthy helps manage hepatitis B virus better. Routine checkups and liver function tests help monitor the liver and catch complications early. Don't rush to take every solution on the internet. What is the truth though? First myth: if I don't feel sick, I don't have hepatitis B virus. That is false. Many people with hepatitis B virus are symptom-free but still carry and can spread the virus. Second myth: hepatitis B virus only affects drug users or those with risky lifestyles. That is false. Hepatitis B virus affects people from all walks of life, including babies born to infected mothers. The third myth: once vaccinated, I'm protected for life. That is also false. The vaccine provides long-term protection, but it's essential to complete the full vaccine series and follow up if needed. If you find out that you have hepatitis B infection, muster courage and talk to your doctor. If you don't know your status, please get tested and get vaccinated. Share this to your loved ones.